Well, over the next couple of months, Americans have a choice, a big choice. They can actually pick a health plan for 2023 or make changes to their current coverage in what is known as the open enrollment season. So joining us to navigate through all the ifs, ands, buts, and helping us through the process is Dr. Rhonda Randall, Chief Medical Officer at UnitedHealthCare. So for people that don't know, what is open enrollment?
Well, this is the season, the time of year when millions of Americans get to pick their health benefits for next year for themselves and their family members. It's important to know what your enrollment dates are.
Can you share with us some advice on what can help people pick the right plan or even save money on their health care?
Yeah, the first thing I would start with is knowing those open enrollment dates. So for the 180 million Americans who get their health benefits through employer-sponsored coverage, generally that open enrollment season is between September and December. You usually have just about a 2 to 3 week period, and you don't want to wait until the last minute to make those decisions. If you are a Medicare beneficiary, 64 million Americans get their health insurance through the Medicare program. Open enrollment starts soon. It begins on October 15th and ends on December 7th. A couple tips that I give when people ask me are, first of all, don't wait to the last minute. You want to get educated, understand what your benefits are. They may have changed from what was available to you last year. They may have new offerings, and some of the financial terms may change as well. A couple things to look into. First one, prescription drug benefits. This is the most commonly used service in healthcare, so you want to pay attention to what those prescription drug benefits are in the choices that you have available to you. The next is mental health coverage. We know now more than ever how important behavioral health care is, so you want to understand what those offerings are in the choices that you have available. The next is look at specialty benefits. Many health plans include things like vision, dental, and hearing, and you're going to want to understand what's included and what's not included with regard to those specialty benefits. Look into wellness programs. More and more health plans are including things like fitness benefits, maybe even gym memberships, for example. And anticipate what your coverage is going to need to be for next year. Maybe there's going to be a change in your family, maybe the birth of a child, for example. Those are some things that you're going to want to take into consideration. What's going to be different for your situation next year than the prior year? And last but not least, I'm telling people this year to consider a plan that has virtual healthcare services. Telemedicine has become very popular, and both patients and physicians are very satisfied with the ability to have access to virtual care services.
Thank you, Dr. Randall. And there's a new term folks are hearing. It's called whole person health. Tell us what that is and why is it so important?
Yeah, it's really understanding that mind-body connection, right, and how important all of the choices that we make as individuals, the community and environment where we live, how all of that ties into your health care. Social determinants of health is something that people are talking about more and more lately as well. I really recommend that it's important to have a primary care physician to help be the quarterback of your health care and help you navigate, whether that is a primary care physician that you're seeing face-to-face, or if you're a younger person and you prefer to get that care virtually, it's important to have somebody who can be accessible to you when you need that whole person care.
All right, thank you so much for going over the fine details. And where can folks get some more information to learn more about open enrollment?
We have all of this information, and then some of the terms that can be confusing that you're going to come across as you're making these decisions on our website. It's uhcopenenrollment.com.
All right, thank you so much again. And of course, you can head to our website, and that's firstcoastliving.net.